Good morning. I am Dr. Shiv Chopra, consultant surgeon and laparoscopist in hospitals in Delhi.
Dr. Chopra, how do we handle a bite, which can be a dog bite, monkey bite, or a human bite?
Well, most of these bites, depending upon, we classify them into 1, 2, 3, depending upon one, where they are, depending upon whether there is a blood contamination, depending upon how deep they are, whether the bone is exposed, whether the mucosa is exposed. But to cut it short, small wounds wherein most of the early layers are not abraded, the first most important thing is they should be cleaned very well, especially preferably with a neutral antiseptic. The best thing would be a betadine, which cleans the area, which provides antiseptic and works on the principle of an oxidizing agent. After that, depending upon the immunization schedule of whether the dog is a pet dog or if it is a stray dog, appropriate immunization has to be done. We try and avoid never to stitch these wounds, especially in the early 48 hours. Why? Because they sometimes can transmit the neurotoxins and it can hasten sometimes the spread of toxins. So you look after the wound, keep it clean. After 48 hours, you take a stand as to whether you need to do a delayed suturing or whether you want to let it heal secondarily. Wounds which are relatively big, which are involving the face, wherein a lot of tissue has been damaged, those patients have to be taken to specialized units where under anesthesia a lot of debridement is done, the wounds are clean, we infuse some anti-toxins, especially the anti-rabies serum, which is used locally, and then the wound has to be reconstructed with a lot of grafts taken from the donor site of the skin.